Providing tracheostomy care. For our goal, the patient exhibits a tracheostomy tube and site free from drainage, secretions, and skin irritation or breakdown. For our equipments, check for bedside table, towel, tracheostomy sanction supplies, sterile tracheostomy care kit, sterile cotton, sterile tracheostomy dressing, sterile basin, small sterile brush, roll of twill tape, scissors, pulse oximeter, clean gloves, 2 pair, mask and goggles or face shield if necessary. For implementation, bring necessary equipment to the bedside stand and or overhead table. Perform hand hygiene and put on PPE. Then, identify the patient. Choose close curtains around bed for privacy. Then, determine if need for tracheostomy care. Explain what you're going to do, why it's necessary, and even the patient does not appear to be alert. Adjust the bed to comfortable working position. Then, if the patient is conscious, place him or her in a semi-powder's position. If the patient is unconscious, place him or her in lateral position. Move the overhead table, close your work area, and raise to waist height. Move the overhead table close to your work area and raise to waist height. Next is put on face shield or goggles and mask. Then, for cleaning the tracheostomy disposable inner cannula, carefully open the package with the new disposable inner cannula, taking care not to contaminate the cannula or the inside of the package. Then, carefully open the package with the sterile cotton tip applicators, taking care not to contaminate them. Then, open sterile up or basin fill 0.5-inch deep with saline. Then, put on disposable gloves. Remove the oxygen source if one is present. Stabilize the outer cannula and remove the oxygen source if one is present. Then, stabilize the outer cannula. Grasp the locking mechanism of the inner cannula with your dominant hand. Press the tabs and release lock. Gently remove inner cannula, place in disposal bag if not already removed. Then, discard the gloves and put on sterile gloves. Pick up the new inner cannula with your dominant hand. Stabilize the pair plate with your non-dominant hand and gently insert the inner cannula into the outer cannula. Press the tabs, allow the lock to grab the outer cannula. Reapply oxygen source, then applying the clean dressing and holder. Remove oxygen source if necessary with cotton tip applicator or gauze sponge in cup or basin with sterile saline or clean stoma under the base plate. Then, use each applicator or sponge only once, moving from the stoma site outward. Then, pat skin gently with dry 4x4 gauze sponge. Then, slide commercially prepared tracheostomy dressing or pre-folded non-cotton filled 4x4-inch dressing under the base plate. Then, change the tracheostomy holder. Next is applying clean dressing holder. Then, remove oxygen source. Next, remove gloves and assist patient to a comfortable position. Raise the bed rail and place the bed in the lowest position. Remove additional PPE. Then, reassess patient's respiratory status including respiratory rate, effort, oxygen saturation, and lung sounds.
誰かをずっと呼んでいる。日の光が少しずつ空気を誰かの声がする。誰かをずっと呼んでいる。日の光が少しずつ空気を誰かの声がする。誰かをずっと呼んでいる。日の光が少しずつ空気を誰かの声がする。誰かをずっと呼んでいる。日の光が少しずつ空気を